Well, hello and welcome to secondstreet.org's public policy discussion series. Today, I'm pleased to talk about a very interesting issue, one that is probably about 10 times more interesting than I thought it would be at first glance. And there's some pretty, I'll say crazy stuff happening in this field. And what we're going to be talking about is blood and blood plasma, particularly when it comes to paid donations, the situation, how it affects patients and so forth. And so joining me is Kate Meer. She's a patient who is affected directly by this issue, but she's also become an advocate because of her own personal experience. So she's got a tremendous amount of information and knowledge on this topic. And so, Kate, thanks for taking a few minutes to chat with me about this.
Well, thanks for having me.
So I think most viewers will obviously be familiar with blood. It's in all of us. And we certainly understand that it's important to have people donating blood because if any of us, say, have a tragic accident where we lose a lot of blood, we need a blood transfusion. But blood plasma is not necessarily the same thing as blood, and there are differences there. Could you just start with the basics and tell us a little bit about the differences between, say, blood and blood plasma?
Sure. So plasma actually constitutes about 55% of your blood. So when you go in and donate blood, they take the whole thing, whereas when you donate plasma, they run it through a plasmapheresis machine where they separate the whole blood, the red blood cells, and they put those back into you and only extract the plasma. And plasma can be processed. Sometimes it's used for urgent needs such as severe burns, but it can also be processed into medications that treat a lot of chronic autoimmune disorders or immunodeficiency disorders or blood clotting disorders like hemophilia.
So it helps people that have those chronic conditions, but then it also is being used to help out with finding a vaccine for COVID-19. Is that correct?
Yes, they're trying to see if convalescent plasma will work, and it had a lot of success back during the Spanish flu pandemic. So it's the same principle, just a different virus. So the idea is that they take the antibodies from someone who has successfully fought off COVID-19, and they transfer those antibodies to someone who's struggling to fight the virus to give them a better outcome.
So I think in that respect, people can understand then that it's important that we have a good supply of blood plasma because it helps patients who are in need, but it also helps potential patients, which could be anyone right now. If you did get COVID-19, with blood plasma helping researchers find a way to defeat that virus. I want to talk now a bit about the supply of blood plasma and the big picture. And correct me if I'm wrong with any of these stats or things that comments that I make about the situation. But right now, Canadians donate very little in the way of blood plasma, and that means that the vast majority of what we use here in Canada is imported. I think it was about 80% of our supply that we use comes from outside of the country, most of it coming from the United States. Have I got those figures right?
Yes, that's correct. And in the U.S., where we import a lot of our plasma from, they actually do pay plasma donors there.
And that was the really crazy thing that stood out to me in this issue is that in Canada right now, it's about 86% of the population or more are covered, or they're living in provinces where you're not allowed to get paid to go and make a blood plasma donation. But yet, so much of the blood plasma that we're actually using as a country is coming from the US, where Americans are getting paid for it. So we're saying to Canadians, you can't get paid, but we'll pay Americans for blood plasma. How crazy is that?
It is absolutely insane. It is so hypocritical. And the reality is that there's so many advantages to paying Canadians rather than paying Americans by, building that domestic industry. And then also in terms of safety, we'd have more control over the safety standards having our own domestic industry rather than relying on countries like the States.
And that was something that I was thinking about too, because during COVID-19 at one point, President Trump said that he didn't want any of the protective equipment that people were using, particularly in the medical field. He didn't want that being exported to Canada because he said we need it here in the U.S. And I think, well, what would happen if the U.S. had a serious shortage or problem with their blood plasma supply, and someone tried to block exports to Canada? That would leave us pretty vulnerable, wouldn't it?
Yeah, that would threaten a lot of patients. You know, a lot of these patients, they rely on plasma transfusions, and immunoglobulin is the most popular usage of plasma. It's where they take the proteins and they put it into a medication that you can infuse, and it helps boost your immune system. Um, and people, if they don't have access to that, there will be people dying, and there will be people very sick, because it's also used to slow the progression of a lot of disorders as well.
Yeah, and that's pretty crazy to think about that. Uh, we are so vulnerable right now on Americans every day going to these blood plasma donation clinics and giving their blood rather than Canadians having that opportunity. Um, the One of the things I wanted to ask you about, just to look at this issue a bit from the devil's advocate perspective, from the other side, that what would be the concerns if we started to allow more people, because some provinces allow it right now, but if we allowed more Canadians to be paid for blood plasma donations, could we end up in a situation where people are giving blood plasma that really shouldn't be? Maybe someone who has addictions problems or something like that, where that's not the type of blood that should be coming into the system. I imagine that would be a thought that most people would have. What's your understanding of that?
That is a large misconception. Because of the new safety standards put into place after the Creever inquiry, even Canadian Blood Services will admit that paid plasma donations are just as safe as unpaid plasma donations. And that rings true because we do rely on paid plasma from the state so much. And there are a lot of screening processes in the donor screenings where if you don't have a fixed address, you cannot donate. And if there is any issue in the plasma, then it's not worth the plasma collection company's time to be collecting from at-risk patients. And plasma is very different from whole blood as well, in that it can be refined a lot more. It can withstand more heat processes and still be viable. So it is much safer to have plasma rather than, say, a whole blood transfusion. The risk is a lot lower.
And I guess they would have to have safeguards in place right now to make sure that the blood that comes into the system is tested properly before it's used by a patient, right?
Yes, as I said, after the Crever inquiry, they did a complete overhaul of the safety standards. So there's a lot more testing being done than compared to back in the 80s and 90s with the tainted blood scandal.
And what would be the big picture impact if we started to allow Canadians to be paid for blood plasma donations? Obviously, that would incent people to do it. But what type of magnitude do you think it would have in terms of Canadians stepping up and saying, yeah, you know what, I'll go do it, to get I believe it's a $30-50 range in terms of the amount of money to actually get for donating blood plasma. What kind of macro effect would we see there?
Well, it would be a huge, huge benefit for hopefully the entire world, not only Canada. If we could get to a point where we are collecting a surplus of plasma, we could be helping patients who do not have access to appropriate plasma therapies have that access all around the world. We could contribute to the global supply instead of draining it, and help a ton of people and give patients a relief of not worrying about shortages and if they're going to have access to their treatment.
Hmm. And
On top of that, on top of that, there's also the economic impacts for just the non-patient Canadians as well. If we have our domestic industry, that's going to create more jobs. It's going to open an opportunity for people to make ends meet a little easier by having that option.
And that's a good point. I'm guessing millions of dollars would stay in Canada each year, rather than going to the United States and buying blood from down there, right?
Right, exactly.
Yeah. Okay. Um, is there anything I want to get to your experience and how this issue affects you? But is there anything sort of big picture that we haven't discussed yet that you think is worth noting at this point?
One thing that I would like to mention is that if you look at places who have legalized paid plasma, such as Czechia, they legalized paid plasma in 2008, and now their plasma collection has increased sevenfold. So there really is the chance to have a dramatic impact, and that can be seen in the statistics already. About 90% of the global plasma supply comes from the commercial plasma industry. So paying for plasma is something that very clearly does work. And a lot of the opposition is based on the fact that in the Crever inquiry, it was recommended that all blood donations should be voluntary. But the fact is that Justice Crever, he could not predict the huge spike in the need for, say, immunoglobulin and other plasma treatments. So although it did lead to a lot of great change, it's kind of an outdated and unfeasible recommendation at this point.
And just on that point, you and I had chatted about this on the phone before, and it was in some of the literature I read, but that right now the government in Canada buys a lot of blood that is coming from the US. And it's expensive in terms of the blood that comes from Canada because people are not on their own coming to these clinics to donate. Some obviously are, but we don't have that huge volume. And so it's costly to try to get people in the door to do this on a voluntary basis. So it's actually more, and this is what didn't seem very intuitive at first, was that the blood that comes from places where people are paid to donate is actually cheaper than blood that comes from organizations that have to try to get volunteers to come forward. Can you share a little bit of your knowledge on that and some of the insight into that aspect?
Yeah, sure. Now, I'll just correct you there that it's plasma that we import, not whole blood.
Right.
But there is a difference. I know it's tough because plasma is part of blood, so there's a blurred line there, but they are very distinctly different. But yes, you're correct that when you look at the advertising needed and staff calling past donors to see if they'll come in to donate, you end up with a lot of unnecessary advertising fees and programs when you could just offer the incentive of payment and people will come to you. And then there's also the fact that if you rely on the entirely voluntary, non-remunerated system, it relies more heavily on government funding. Whereas if you have a private industry coming in and bearing those infrastructure and operational costs, then you get the benefits of having that industry and having the jobs within Canada, but you're not bearing the huge costs of having to set up all of these plasma collection centers.
And I know one of the stats I saw was from Australia, but I think will give Canadians some perspective on this issue. And that was that if Australia switched to having more blood coming from paid plasma, people getting paid to do it, the costs would actually come down by hundreds of millions of dollars. And so I think if you're a Canadian and you're watching this and you're thinking, well, I don't require blood plasma on a daily basis, and I don't plan on getting COVID-19 and other problems, I don't, if someone thinks they're not affected by the plasma aspect, well, they could be affected as a taxpayer because hundreds of millions of dollars potentially could be saved going into other procedures, providing more hip operations, knee operations, cancer treatment, whatever, and decreasing some of those waiting lists, couldn't it?
Well, exactly. And on the other hand, you also never know when you're going to need plasma
Mhm.
because I wasn't diagnosed with my condition. Well, my symptoms started when I was 25, and I wasn't diagnosed till I was almost 29.
Yeah.
So you never know when you're going to need it or when somebody you love is going to need it.
Yeah, and I think that's a very good point. Is that I was approaching this from an assumption that someone may think, well, it doesn't affect me. I mean, you raised a very good point. You never know when something like this could come along. I mean, we obviously all hope that it doesn't, but it can. It's just the way life goes sometimes. Now, that's a good opportunity to shift to your own personal experience. Um, could you share a few details about how this issue affects you personally?
Sure. So I have a disease called multifocal motor neuropathy, and it's a progressive disease where your immune system is attacking the axons of your motor nerves.
Mhm.
So you have to have treatment where you are retraining your immune system basically to stop attacking your motor nerves.
Mm.
So I was put on immunoglobulin treatment, and there's two forms, either the IV drip that takes like 4 to 5 hours for your infusion that you have to go to the hospital for, and I was going every 3 weeks. Or there's a subcutaneous, which is just injections under the skin. It's like a slow infusion that you can do at home, and there's a lot less side effects. So I, living so far away from the hospital, when I started treatment in March 2019, our plan with my doctor was always to switch almost immediately over to the subcutaneous, or SCIG is a short form. um, I was supposed to switch right over because I live so far from the hospital and I have three very busy boys. And with the IV treatment, I was wiped out for about 2 days afterwards. I was just exhausted. And a lot of people get side effects like headaches as well. So I was supposed to switch over in May 2019, but then was notified that because there was a shortage of subcutaneous immunoglobulin, that I was not going to be able to switch at that time. And
Mm.
I had to wait that out until the end of September 2019 before I could finally switch over to the subcutaneous home treatment.
So ultimately, it means that uh, because of the shortage issues, you're ultimately having to spend 6 hours in a car fairly regularly, driving to and from the hospital, uh, and you're having more side effects, which impacts you the next day after the transfusion and so forth. Um, Now, you also mentioned you've got three young kids. I imagine that's pretty difficult if mom is knocked out for a period after transfusion, or if you're having to take your children to go to the hospital, or even if you're just gone for 6, 7 hours, whatever it is. That must have a difficult impact on your home life, doesn't it?
Oh yeah, it definitely was tough, and thank goodness for their nana and all her help with that
Yeah.
situation. But yeah, it's really difficult to try and raise three young kids when you're trying to deal with all these side effects.
Yeah, I'm sure that would be challenging. And if you don't receive the transfusion, if we think about hate to think about it, but if we were in a worst case scenario and there was a serious shortage and you did not receive the transfusion, what would be the impact?
My disease would be allowed to just progress as it naturally would.
Mm.
So that would affect my mobility because it affects all the lower motor nerves.
Mhm.
So that could be my arms, my legs, my hands, my feet. So like any voluntary muscle in the body can be affected.
Ouch. And I mean, I could certainly see why you'd be so motivated to be speaking out on this issue, researching it, doing what you can to affect public policy decisions, because it can have a huge impact on your life. And you mentioned earlier that for some patients, because of other diseases and health issues that they have, that it could be as serious as death if they don't receive their transfusion. So I can understand why you're so passionate about this. What do you think would be the impact then if governments switched? And we talked about this a little bit before, but if governments suddenly switched and started to allow people to get paid for their blood plasma donations here in Canada, how would that affect say, yourself and other patients at the grassroots level?
It would be a huge relief because we would know that we are having a secure supply, we have reliable access. And I know a lot of people on the opposition, they'll say that, well, if it's a private company, they have no obligation to keep that plasma within Canada. But at the end of the day, we don't collect near enough anyways and are importing it. So even if we're contributing to the global supply, it all circles back around and it helps patients all around the world. And during the shortage in 2019, there were some American patients that were affected even worse than Canadians, just because of contracts and
Mm.
the web there. But um, there were patients who were having to stretch their treatments out by an extra 2 to 4 weeks, or
Mm.
going month to month, where they may not know if they were going to have access to their treatment at all. And so it's a survivor's guilt when you see that happen and you're still getting your treatment. And so it would just be a huge relief for patients, for themselves, but also, for other patients, because when in the days of the internet, where now we can connect with other patients with the same disorders all around the world, we are hearing about our friends in the States being affected by this.
Mm. I can understand why it's so stressful for people in this situation to be, you know, concerned not only about their own health and well-being, but those of others, and the potential for shortages and the geopolitical situation we talked about, uh, with the PPE situation and President Trump wanting to clamp down on that earlier. I mean, I think the last thing a patient needs is to be worried about politics potentially impacting their supply of blood transfusions, or blood plasma transfusions. Is there anything on this that we haven't talked about yet that you think viewers might find of interest or should know?
I think the most important takeaway is, on this issue, people need to dig deeper and listen to patients. Patients, we've been relying on paid plasma for years. There hasn't been a viral transmission through plasma therapies in over 25 years. We know it's safe. We've been putting it into our body. We bear the biggest risk. So it's the patients that we need to listen to in this discussion,
Mhm.
rather than, special interest groups or policymakers. It really is important to listen to patients.
For sure, and I think you may hit the nail on the head there, right? I mean, it's you're having to put this into your body, so you're going to have a greater incentive, more than others, to pay attention to what's going on, and understand the implications of government decisions and how these issues affect yourself and other people that are going through it. Thank you so much for your time today. Where can people go if they want to learn more about this issue?
I have a website. It's called Plasma for Life, is our advocacy organization that Peter Jaworski and I have founded together. You can visit our website at www.plasmaforlife.org. PLASMAFORLIFE.org. And there's links to our Facebook and Twitter, which is a little bit more actively updated than the website is just kind of a basis for information. But yeah, feel free to connect with us. And on our website, there is also a link that if you're interested in starting a petition in your area, you can use that as a template to try and get the Voluntary Blood Donations Act repealed in your province, which I know Alberta is working on. But it's something. And on that note of the Voluntary Blood Donations Act, I want to also stress that these laws came into place in like 2014 and later. And these were specifically made to block a commercial plasma industry in Canada. It's not a long withstanding law we're trying to repeal. And being that we import so much plasma from paid donors, it really is not protecting anyone.
I'm glad you mentioned that because that's an important thing for people to keep in mind is that in Alberta they are looking at changing this, and that these changes, initial changes, have been fairly recent. They haven't been around for a long time. So we're going to have a blog post on our website too that people can go to if they want to see a little bit more information there too, and that's of course secondstreet.org. So again, Kate, thank you so much for your time today. We really appreciate your expertise on this issue and sharing some insight on what's happening, and certainly sharing your own personal experience.
Well, thank you so much for this platform and to give patient voices a louder voice.
Thanks again.